first trip was to Rayella to see the feeding program at Rayella Elementary School. And it was amazing to see that all these children were being fed breakfast and lunch. And without First Love, they probably would go hungry most of the time. You know, after my first visit, it was real clear that the needs were more than just food. There's physical needs and a lot of health needs that I felt that we could get involved at. Our school has many faculty members that are trained dentists, ophthalmologists, doctors, veterinarians, nurses, and I could see that, you know, just by encouraging them to come along on a team, that they would be able to meet needs that I could never meet myself. So we put together a plan to put together a dental clinic, bought some equipment, gathered a team, and we really didn't know what to expect, because in Kenya, being a third world country, you're not quite sure what kind of equipment will match up, the electrical outputs. But it was amazing to see that God blessed it. I mean, he just basically worked behind the scenes to kind of draw everything together. And the team experienced just a huge amount of satisfaction working with the children, staff, adults from the slum and the school. And it was an excellent trip.
We ended up with about 250 visits on the time that we were here. We had to improvise a lot, use instruments to accomplish things that were very creative and maybe you wouldn't think to use them. But really everything worked out pretty good for us and for our patients.
I became connected with First Love through Dick Lupke. He is one of the founders of Pima Medical Institute. I'm at the Albuquerque campus, and he provided an opportunity for a student to come to Kenya and provide some dental hygiene work on the children here and as well as the community. When I was chosen to come to Kenya, it was a surprise for all of us. I told my family about it, and my husband was ecstatic, and he said that was something I needed to do. That I've worked so hard at what I do in the dental hygiene program, this opportunity couldn't be passed up. I think we came prepared mentally for a challenge, and it was so much better than what we expected. So we came out with expectations that were surpassed equipment-wise and just facility-wise.
We worked in the medical clinic in Rayella, the slum area in Kabara, and most of what we were able to do was first aid. A lot of wounds, some that we were worried about tetanus because they don't have access to immunizations, and it is dusty. A lot of eye care. We took a list of probably 30, 40 people who really needed to have eye exams that were good and eyeglasses that would help them. A lot of people with high blood pressure that just goes unrecognized and just makes them feel bad all day long. I see the women carrying the heavy water on their head and the children, 3-year-old children on their back and lugging things this way, and I just assumed that they had always done it that way, and so they had become accustomed to it, but it has taken a toll on every one of them, and many of their chief complaints were back pain and headaches from neck strain, and they didn't know that that's what it was from. Well, we were very fortunate to have a therapist, a back therapist with us, and she saw maybe half of the ones that we had diagnosed with back strain.
We had the opportunity to treat a lot of people here in Kenya. Back at home, in a normal practice, you see anywhere between 8 to 10 patients a day. Here in Kenya, we were seeing anywhere from 20 to 40 people a day. The experience I gained from being here is outstanding, amazing. It's just something that I couldn't get at home.
The first couple days, Monica was still a student, but as the week went on, she became a full-fledged member. She has done more dentistry in the last 2 weeks than she probably has done in the last 2 years in school.
One thing that I might have been surprised at is the need here. There are so many people that can't afford to see a dentist or even get their teeth cleaned, just minor dental procedures that aren't being met. So I was really surprised at how many people, from age 4 to age 50 that have never been to a dentist before.
We've noticed about so many of the patients here is they have had too much fluoride in the water, and so their teeth are mottled with fluorosis, brown stains throughout the teeth. And we saw this on most of the kids that came in. And sometime in the second week, at the end of the day, this little 10-year-old came in, and she was so nervous. And we said, you know what, we're just going to do something special for this little girl. And so what we did was place composite veneers, which is just a type of dental restoration. But we placed composite veneers on her upper anterior teeth, and were able to hide all the discoloration that was there. And I was unprepared again. I knew we were doing a good thing for this child. I guess she had been very shy and very sensitive about the appearance of her teeth, and being able to change this was just great. So we did it on the second child, a teenager. This girl I think was maybe 17 and had the same situation, and we provided the same procedure. And she went out after we were done, got her hair fixed, and it was like she was a different person. So that was, that had to be the highlight of our trip, is taking these two little girls and making them, giving them a new start, a new self-confidence that they didn't have before.
We had several favorite patients. One of them was a 50-year-old gentleman who was in shape, complaining of eye headache. So his vision was blurred. We had him read close up and far away. So then we happened to have a whole packet of glasses. And as soon as he tried them on, his response was, "Oh yeah." So we thought that was really nice. Then we had a kid who was about 17, 18, having an asthma attack, was just discharged from the hospital, given pills, so he needed an inhaler. So it was just really nice to hear his mom thank us for saving her child's life, because it's hard, number one, when you can't breathe, and it's even harder to see your child not be able to breathe.
The most amazing one was a woman who was complaining of pain on this side in her back, but only on this side. And so we wondered if maybe she might have had a hernia. The therapist came in and saw her and had her stand up, and her one leg was about 3 inches shorter than the other. So we cut out cardboard and we stuffed it in her shoe, and she was walking straight when she went out. And to us, simple things like that, but I mean, she's lived with that pain for 20 or 30 years, without knowing how to correct it. So things that we take for granted, we can really help them with. They need eye doctors, they need dentists. The number of people who came in with complaints about pain from their teeth. One girl said, she went to bed every night with a severe toothache for over a year. How can she concentrate in school when she's in pain that much? It's impossible. The physical therapist can do an amazing job to help these people learn how to carry and feel better so they're not always in back pain. Healthcare disciplines that we don't think would be able to help here, I think, really need to think about, there must be something there that I can do to help.
It's changed me in many ways, and other professions, I believe, could benefit from that as well. If you're in the medical or dental field, there's a sense of compassion that you have already, but it's far enriched when you come out to a country like Kenya and provide services for those who are in need. And it just opens your eyes up to a whole new way of seeing things.
One of the great things about this is that it's a 2-week venture. Not many of us can become full-time participants in an outreach program like this, but 2 weeks is something that we can do. And if we could get a half a dozen dentists doing 2 weeks throughout the year, then we can change a generation, dentally speaking, here. We did a lot of great things, but it's just a drop in the bucket. And so what we need is the follow-up and the continuing care that could really make a difference for these kids.
You know, it's been amazing to see our teams, our medical teams from Pima Medical Institute, the rewards that they've gotten in return for what they're giving. They would have never have imagined that though they came to serve, the love that they received, you know, was just unimaginable. You could not even begun to think that in the midst of serving, that they would feel such a sense of satisfaction. You're not getting paid anything in terms of money, but the rewards that you're getting in terms of changed lives and happiness and relief of pain has just been unimaginable. And I think to a person, everyone that's been on the medical and dental teams have come back saying, you know, I wish I would have done this earlier in my career because I'm giving back to humanity that they don't really have as many opportunities stateside to be able to do that. But here there's an ocean of needs, and the best place to start swimming in the ocean is just to put your toe in and get wet and experience firsthand the rewarding experience of giving to people.
The experience can't be matched, what I've seen here.